The general state of this issue is that the Trump administration has directed federal agencies to remove all records related to their employees' COVID-19 vaccination status. This order, issued by the Office of Personnel Management, OPM, is part of a broader effort to reverse what the administration views as harmful pandemic-era policies from the previous administration. The directive states that, effective immediately, agencies cannot use an individual's COVID-19 vaccine history or exemption requests in any employment decisions, including hiring, promotions, or discipline. Agencies have been given a deadline to certify compliance with the order. This move comes after the federal vaccine mandate for employees was already struck down by courts and ultimately rescinded by the Biden administration in 2023. The new directive essentially seeks to eliminate the lingering effects of those mandates by purging the data itself, though employees have a 90-day window to opt out of the deletion if they wish to keep their records. The reasons cited for this directive are primarily centered on reversing what the administration calls harmful pandemic-era policies. The Office of Personnel Management, OPM director, stated that during the pandemic, federal workers were fired, punished, or sidelined for simply making a personal medical decision. This action is presented as a way to ensure the excesses of that era do not have lingering effects on federal workers. By protecting employee privacy and preventing past vaccination status from influencing future employment decisions, such as hiring or promotions. The administration's view is that with the public health emergency over, these records are no longer necessary for public health purposes and should not be used in any way to disadvantage employees. This move also follows and expands on the legal and administrative challenges that led to the original federal vaccine mandate being rescinded. The immediate consequence is that federal agencies will no longer have a centralized, standardized record of their employees' COVID-19 vaccination status. While employees have a 90-day window to opt out of the data purge, the default action is deletion. This move is intended to ensure that past vaccination choices and mandate non-compliance cannot be used in future employment decisions, such as hiring, promotions, or disciplinary actions. However, critics are concerned that this action could have broader long-term public health consequences. The deletion of this data could make it more difficult for public health officials to study the long-term effects of the pandemic on the federal workforce or to respond to a future public health crisis. It also removes a potential source of data for research into vaccine effectiveness and the health outcomes of different population groups within the federal government. The directive marks a definitive step in dismantling the administrative framework created to manage the pandemic within the federal workforce. One proposed solution is for a future administration to reverse the current order and reinstate the policy of retaining employee vaccination records. However, given the political controversy surrounding the issue, this is not a simple solution. Another approach could involve the legislative branch. Congress could pass a law that explicitly defines the acceptable uses and retention requirements for federal employee health data, striking a balance between privacy concerns and public health needs. A more immediate and less politically charged solution centers on data preservation. While the current directive orders the deletion of records from personnel files, a third-party, non-governmental organization could be created or tasked with securely archiving this anonymized data for research purposes. This would protect individual privacy while still allowing public health experts to study the long-term impacts of the pandemic on the federal workforce.